Great. So welcome, everyone. So nice to see familiar faces and names and phone numbers. Thanks for joining us. And again, this Zoom call is being recorded. Today's presentation is a program of the JFCS Giving Circle. You all know what JFCS is. So what is the Giving Circle and what is this program? So the Giving Circle is a group of JFCS supporters who've shown consistent generosity and loyalty and partnership with JFCS through the support of the people who are on this call and others like you. You sent a message to us about how critical you believe that our work is and the significance that our work has on the community. And you've actually played a significant role in allowing that work to happen. So thank you for that. So for you and others like you, we have put together a series of presentations over the course of the year. And we share with you through these presentations some details about the work that we do, the challenges our clients are experiencing, and more about the issues that we focus on as an organization, but we do it in a way that we don't normally share with the general public. We hope that you'll find it interesting and relevant and a good use of your time. So I'm going to introduce now briefly our panelists for this evening. We have Javier Janik. Javier is the Program Manager for Economic Opportunity and Investment at Neighborhood Allies. We also have with us Brenda Green. Brenda is a manager at JFCS in our Refugee and Immigrant Services Department. And we have Becky Johnson, who is the Director of our JFCS Career Services, and Becky is also serving as the moderator tonight. So I'm going to mute myself and hand it over to Becky.
Perfect. Thank you, Jordan, and good evening to all of you who are joining us. As Jordan mentioned, I'm Becky Johnson. I'm the director of our JFCS Career Services Department, and I'll be moderating tonight's discussion. We're really honored to have you with us, and we hope that this is an informative discussion that we have for you tonight. I just want to say that I was really honored when I was asked to moderate this panel, in part because I was a financial counselor in my previous work, so this topic is near and dear to me, but also and primarily because of my current role as the Director of Career Services. You know, we're really focused on bringing all job seekers, whether it be a new or first-time worker, a parent returning to the workforce, someone looking to make a career change, or even a refugee who's looking for their first job in the US. Oh, I'm sorry. Okay. Whether it be a refugee looking for their first job in the US, our goal is really to bring all of our job seekers to the point of self-sufficiency and job success. And we know that earning a livable wage and having access to financial and other resources and support that allows everyone to feel stable, to be able to weather financial and other shocks, and to feel comfortable and able to plan for the future are all vital components in helping our clients and even our community and our individual neighborhoods thrive. So over the next hour, we are going to hear from Javier and Brenda, who are some of our staff and key community partners, about financially insecure folks. How and why did someone get into that situation? And we're also going to hear about some local and national efforts being made to combat financial insecurity, to promote banking access, and to help hopefully to reduce poverty. And so at this point, we're going to start by turning it over to Javier Janik from Neighborhood Allies. And so Javier, I'm going to pass it off to you. I will, one other thing, a few housekeeping reminders. We will have time at the end for questions. So if any of you have a question, please hold them until the end or feel free to drop them in the chat and we'll try to address them either through our conversation or at the end of tonight's discussion. So thank you. Javier.
Okay, thank you, Becky. It's great to be here tonight. Thank you everybody for joining us and thank you to JFCS for inviting me to be a part of this panel. As Becky mentioned, I work for Neighborhood Allies. We are another nonprofit organization based in Pittsburgh, and we work to provide on-ramps to prosperity through capital and strategic resources. Obviously, a few of those things I'm going to talk about tonight. Before I even get into that, though, we as an organization and also just personally believe that the absolute key to being able to do that is through partnerships, and through partnerships like the one between JFCS and Neighborhood Allies that I've been fortunate enough to be a part of here for a while. JFCS has probably worked with Neighborhood Allies well before I started, which was about 2.5 years ago. But I've been working with JFCS through like financial education and programming that I'm going to speak of here in a second. Basically, I'll wrap that all up in saying thank you to the supporters of JFCS, because it all fits together, and it allows not just JFCS to do what they do, but it also in many ways allows JFCS's partners to do what they do and what we do. So with that all being said, I am going to jump into talking about some of the work that I do at Neighborhood Allies. I'm going to focus on, I'm going to pretty heavily focus on a program that I run called Bank on Allegheny County. The purpose of Bank on Allegheny County is essentially just to connect people to safe and affordable bank accounts. We believe that having a bank account is the first step into the financial mainstream, right? It's a necessary prerequisite to so many steps along the financial journey, and a lot of steps that I do think a lot of us, me being one of them, take for granted, because they were more easily accessible for me, for example, growing up. I got my first bank account when I was 15, 16. It was a pretty simple process. I had my parents to help me guide along. But those are realities that a lot of people unfortunately don't face, and benefits that a lot of people don't have. So before I continue to talk about that, I would like to basically lay out, I'm going to be talking a lot about, I'm going to be using two terms specifically, probably a lot throughout my presentation, referring to populations and demographics of the unbanked and the underbanked. Somebody who is unbanked is pretty self-explanatory. It's somebody who doesn't have a savings account or a checking account at a bank or a credit union. Underbanked is a little trickier. It's somebody who they may have a savings or a checking account, but in the past 12 months, they have used what we refer to as like costly alternative financial services. The most common examples being check cashers, payday lenders, auto title loans, any of these things that are more likely to be used if you don't have a basic checking account. The problem with those services is in many cases they are predatory and they are very, very costly. Somebody who is unbanked or underbanked over their lifetime will spend an average of $40,000 on those alternative financial services. And this gets into, the overarching point that it is expensive to be poor, right? And Brenda, I hope I don't want to steal too much of your thunder because I know you're going to talk about this as well, right? But it fits so well, obviously, into the whole banking conversation of, if you don't have a bank account, you're digging yourself a hole, and it just becomes more costly and more costly because you get into a cycle that is very hard to break, unfortunately. With that being said, like, who is this a problem for is what I want to talk about next. Who are the unbanked and underbanked? What challenges do they face? What can we do about it? The good news is that the nationwide unbanked and underbanked rates have been decreasing. The FDIC does a survey every 2 years on unbanked and underbanked households. And the most recent one that they released in 2021, 4.5% of the country is unbanked. And that is an all-time low. So it's like, good news, we've made progress. 4.5%, but 4.5%, one, it still represents millions of Americans. And two, it disproportionately affects people of color, people low and moderate income households, right? So the unbanked rate in the country is 4.5%, but the unbanked rate for Black Americans is over 10%. It's, I think, 11.3%. Hispanic demographic is 9.3%, I believe, almost 10%. And then there are huge disparities in income levels as well. So this one I will have to cheat on and look at my notes. But for people making less than $15,000, the unbanked rate is almost 30%. For people making $15,000 to $30,000, the unbanked rate is nearly 20%. So you might hear 4.5%, and yes, it's good news. Like I said, it has been decreasing. You might hear 4.5% and think, oh, that's not too many Americans. But again, as are a lot of things, it's the bigger issue is in the inequities and challenges that certain demographics face, and we'll get into sort of why. Why are those numbers so disproportionate? It's for a lot of reasons. The two biggest ones, this is also essentially surveyed in the biannual FDIC survey. The two main ones are lack of trust in financial institutions. And that is, that can be cultural, but also, it has a long-standing history in our country, right? I mean, it goes back to the reason the CRA Act was invented back in the 70s, and just all the discriminatory lending practices and banking practices that this country has unfortunately been a part of its history. And so rightly so, a lot of demographics, they don't have positive images or thoughts of financial institutions because they feel like they've done them a disservice for so long, and they are, historically true and accurate in saying that. The other, and so there are ways to improve that aspect of it. But the other main reason that people are unbanked or underbanked is just from a product side, right? It is, it's too difficult too often to get a bank account. And I'll go into the specifics of that, but just like even the minimum opening deposit for a lot of checking accounts is $50 or whatever. A lot of people who are struggling, living paycheck to paycheck, it's difficult for them to have $50 at any given point in time to open a checking account. And then a lot of checking accounts, they'll have minimum balances. They'll charge overdraft fees when people of low income start to have low balances and accidentally overdraft their account, et cetera. And then it just, like I said earlier, it's just that hole that keeps being dug deeper and deeper, and they rack up one overdraft fee, and one overdraft fee becomes 2 and 3, and before they know it, they have a $300 negative bank account, and then they just they close it. They never have any interest in doing it again because they had a terrible experience with it, and they would rather go to the check casher or payday lender. That's unfortunately on every street corner in a lot of low income communities. So with that said, our work with Bank on Allegheny County is to essentially resolve those problems and promote banking access. We do this in a lot of different ways. We convene a coalition called Bank on Allegheny County, which is essentially like, and Becky actually sits on this coalition. She comes to our quarterly meetings where we convene financial institutions, community organizations to talk about these issues, to talk about, how do we better serve people who, don't speak English at financial institutions. And we'll discuss those issues at quarterly meetings. The other piece of it, though, is the the work that we do with financial institutions, and then actually connecting people with bank accounts. So I mentioned Bank On Allegheny County. It's the local chapter of a nationwide initiative. And basically what it is Bank On is built around a set of standards meant to make banking safer, more accessible, and ultimately cheaper, right? So the accounts have to meet a very long list of standards, of features. The key ones are that they are no overdraft checking accounts. So people will get, they're still very, they essentially have all the features of a basic checking account. People will get a debit card. They can still do online bill pay, online mobile banking, all the, sort of all the standard checking account features. But they can't overdraft the account. They can't get charged overdraft fees. The accounts also have a $5 or less a month limit on monthly maintenance fees. I will be very frank in saying that about half of the accounts in our area that are Bank On certified don't have any monthly maintenance fees. And those are the ones that I promote. I will just be very frank in saying that I hate the accounts that charge $5 a month. I understand how significant $5 a month can be for a lot of the people that I work with. So I don't even bother promoting those, essentially. So, how I will close my part of the presentation in talking through a couple of the what do we do to actually, how do we actually connect people with Bank On certified accounts? It is essentially through program integrations, many times through partners. And I'll give two examples that are sort of two of our larger integrations. One of which is our youth financial capability programming, which is actually what I work with JFCS on. The generality of this program is that we try and connect with youth employers, like specifically teenagers, 14 to 18-year-olds, who are oftentimes getting their first job. And we see it as an opportunity to, okay, now you have a job, why don't you get a bank account, get set up with direct deposit? You don't have to worry about those paper checks. You don't have to worry about giving them to your mom, your uncle, your brother, or whoever to cash them for you. Stop relying on Cash App and Venmo and Chime for everything that you do, because even though those things have benefits, you're doing yourself a disservice if that's all you use to manage your money. So we connect with we connect with youth employers, and then we set the kids up with these accounts that are structurally sound, right? If I was a parent, I certainly would not want my 14-year-old to have an account that they could overdraft, right? So it's sort of like we're giving these teenagers accounts with training wheels, right? With the safety bumpers in the bowling alley. The other integration that we are working on is with Allegheny County's Department of Human Services, which is they're basically currently doing like a $4,000 cash payment to youth that are aged out of foster care. Which is another population that is, historically unbanked and underbanked, and a lot of these people they're applying for this cash assistance, but they don't have a bank account to get the payment transferred to. So again, working with Allegheny County DHS, working with our banking partners to provide applicants to this program with that checking account that is. For all intensive purposes, free. I do hesitate to use the word free because there are still some charges. Like if they sign up for a Citizens Bank account and take their card to a PNC Bank ATM, they're still going to get charged an out-of-network ATM fee. But there's unfortunately nothing we can do about that one. So I will end there, and then I will turn it over to Brenda. I welcome any questions, and then I will also say I'm sure my information will be shared. If we don't get to a question, feel free to reach out to me, and I'm happy to touch base with you on any more specifics.
Thanks, Javier. Brenda, before you jump in, I wanted to thank you, Javier, for sharing that information. I think it's so important to understand the key terms and definitions that go into what it means to be financially insecure or unbanked or underbanked. And one question I had for you, Javier, before we move on is you spoke about those national statistics, which were great. And for the purposes of those of you who are joining us for tonight's call, to frame it, for Allegheny County, our banked and underbanked rate is actually hovering around 30%, which is significant when you think about our county. That's 360,000 individuals. That's the size of the city of Pittsburgh. It's a significant number of unbanked or underbanked folks living in our community alone, let alone when you look at the national numbers. And that's actually up. I remember when I was doing my financial empowerment work, Allegheny County was closer to about 25%. So we've seen an increase. And some of that comes from mistrust of financial institutions. I think shocks weathered through COVID and the pandemic, and folks moving away from those more mainstream financial institutions. One question I had for you, Javier, before we turn it over to Brenda, is you spoke about Bank On and the financial partners. Could you share with us how many certified accounts, meaning those safe and affordable bank accounts, those accounts that are great openings for someone just entering into the banking system or looking for a really safe account? Do you have the list of the accounts or the number for those on our call?
I actually, I'm gonna share my screen right now. We have 13 certified accounts in our area that represent 11 financial institutions. Like basically PNC has a couple, and Citizens has a couple. On Bank on Allegheny County's website, one of, I think, the most useful resources of Bank On is this chart that outlines the key features of those 13 accounts. I distribute this to a lot of partners, or just, potential customers that come to us. It very basically breaks down, okay, which of those 13 accounts charges a monthly maintenance fee, which of them are free, how much money do you need to open each account? A couple of them, some financial institutions are more lenient in working with people who don't have a social security number. They either have an ITIN or they have a foreign passport number, or like I was talking about with the youth accounts, there are very few accounts there are very few financial institutions that will open an account for a minor, even though it's surprisingly legal. Like a 14-year-old is actually totally able to have their own checking account without their parent on it. So this chart breaks down all of that. I do believe Becky has the most latest version, but if whatever, if anybody wants it, I'm more than happy to share that resource with everybody.
Perfect. Thanks for that, Javier. And for those of you following us on the call, I did drop the link for Bank on Allegheny County in the chat. It's a wonderful website. Please check it out. Learn more about the Bank On initiative. And I'm going to turn it over to Brenda now, who, as Javier touched on, is going to dive a little bit deeper into that cost of being poor and what that really looks like in the daily lives of members of our community, including clients that we serve. So Brenda, I'll pass it on to you. Thank you.
Thank you. And thank you all for joining. As Becky said, my name's Brenda Green, and I'm the program manager in the Refugee and Immigrant Services Department. And what that basically means is I provide some technical support for our director, who has an extremely big job, and also some mentoring support for the supervisors of our numerous programs. And additionally, I am the primary manager for our ISAC program, which is Immigrant Services and Connections, which is a program that runs parallel, although there is a lot of overlap as well, with our refugee resettlement program and some of the other programs within the department. And yeah, so when we talk about, so often we're talking about the poor and that people talk about, well, they just need to budget better, or they just need to get a better job or whatever. But one of the things that I think a lot of people don't realize is that there are, as with the banking fees, it's very expensive to be poor. Like they're spending more out of pocket things on things that we take for granted. Like this is my Connect card. I'm a big believer in public transit. I love traveling by bus because in addition to by leaving my car at home, I don't have to worry about parking in Squirrel Hill, but I also get an extra 40 minutes of reading every day because my commute's 20 minutes each way. So next week, which is the last week in May, I'm going to go over to customer service at Giant Eagle and I'm going to buy my June bus pass, which is $97.50, which gives me unlimited use of any bus at any point. It doesn't matter how many times I use it. That gives me a huge savings because I have the resources to purchase it on a monthly basis. Many of the clients that we work with in our department do not have those resources. So, $100 is a lot to take out of your paycheck, especially if you're making the minimum $7.25 minimum wage in Pennsylvania. So what happens is they might be able to buy a weekly pass at $12.50, but most of them tend to pay every time they get on the bus. So they're paying in the course of a month and a year considerably more than people like me who are able to buy my pass up front. So just quickly before we got on, I did some math. Not everybody takes the bus every day, but I'm using the figure of going to work and home. So 2 trips a day. So the rate one way is $2.75. But most people, between doctor's appointments and picking their children up from childcare and going to visit friends or going to church, whatever, they're using the bus much more frequently. So I figured let's limit it to 2 just to get a lower number, and then do it for 365 days. So while I pay in the course of a year, I pay $1,170 for my bus transportation. Somebody who's paying ride by ride because they're literally digging in their bag to find the money to get them home from work that night, they're paying $2,007.50 for the same service that I'm getting because they just don't have the $100 up front. Another thing that's related to transportation is that we have a lot of clients in our department that have to go to Philadelphia or New York because maybe they have, even those that are naturalized US citizens, they often maintain the passport of their home country. Well, there are consulates in Philadelphia, and then the majority of them in New York or DC. There's not a consulate office in Pittsburgh. So if you have to go, like we used to have a staff person here who was originally from Uzbekistan, and they, even though they came here on the green card lottery and they're American citizens now, they still want their 3 children to have Uzbek passports. She has to go to New York City once a year. Okay, so if you have a credit card, that's cheaper than if you don't. And granted, credit cards oftentimes get our clients into trouble, but the majority of them do not have access to credit. So for instance, with Greyhound, to go to Philadelphia, if you have to go to the Guatemalan consulate in Philadelphia, it costs, if you go online and buy your ticket the way I do, it's $60 plus a $3.99 service fee for buying online. Okay, because companies want to get away from having a lot of staff doing this kind of stuff, and there are many other reasons for that too. What they want to do is drive people to the internet to purchase tickets. So if you go to the Greyhound terminal and buy that same ticket one way to Philadelphia, the cost is $87.98. Plus you have to stand in line at Greyhound and you have to use the bus to get to Greyhound. Now, granted, it's like $26. So you think, well, $26 isn't that big of a difference. Well, $26 is sometimes the difference between you being late with your utility bill. So, not having access to a credit card or not having a good credit rating often costs more for our clients. The other thing I want to talk about briefly is the housing thing. Is that the standard guideline, and I double checked this earlier in the week, since 1981, the guideline from the feds has been, when they were concerned about income levels and families becoming cost burdened, they stipulated this formula, which I'm sure some research went into it, but then obviously it was just down to an arbitrary decision, that they recommend the 30% rule, that families should not be spending 30% of their gross income before taxes on housing. In poor neighborhoods, and we're not talking about people living significantly below the poverty level. This is true a lot of times for working class families, and it's true for middle class families. if they don't own a home, they are paying oftentimes considerably more of their income for housing. I checked our housing matrix that we have that lists all of our clients that are currently enrolled in what they're paying in our refugee program. And it's actually like between 85 and 90% of their income. And that's a couple different factors. One, we have a huge housing problem in this country that is systemic, and there are many issues that have to be addressed in that. The other thing is we're seeing families that are larger than what we once resettled. So if it's a family of 8, they can't rent an apartment. They have to have a house. And with a house, it's rare to get in, like with apartments, a lot of them have utilities included, or at least most of the utilities. Maybe you pay for your trash, your cooking gas, and your Duquesne light bill, but your heat is included and a lot of the other fees. So our clients are spending a huge amount of money on housing. So that leaves them almost nothing left to cover monthly expenses, and God forbid that they should have some type of crisis. And I'm going to share you one of those examples. And this is a real case. This is a family that our refugee resettlement program resettled about 3.5 years ago. And it's a Burmese family. And I do want to point out that I'm intentionally using Burmese or Burma, because even though that name no longer exists, refugees who were persecuted by the Myanmar government are very touchy about that, as they are with many asylees, refugees, people fleeing oppressive governments. So we let clients, when we ask them where they're from, we put in our database whatever they say. Just like my hairdresser, who is the granddaughter of Vietnamese refugees, always says that her mother still says Saigon. She will never say Ho Chi Minh, because there is a trauma that's associated with that. So this is a Burmese family from Burma. They were actually persecuted they were an ethnic minority as well as a religious minority. They arrived here, it was a family of 4. They had a 7-year-old and a 9-year-old. Since then, they have had another child who at the time that this incident happened was only 6 months old. This was a family that was doing really well. Like, our goal of all of our programs in our department is self-sufficiency. And to provide these clients with the skills and the resources they need and the education, the cultural orientation to get them to that point. And this family was overall doing really well. And I should let you know that the children had English because they were learning English in school. The children learn much quicker, plus children's minds just learn languages quicker than adults. Dad was pre-literate in his own language, which was Chin, which is a Burmese dialect. So he could not read or write in his native language. So learning English was always going to be difficult. Plus, as the primary wage earner, he had to go to work right away. So he had just a couple weeks of English as a second language classes. Mom was able to stay home a little bit longer, but she quickly went to work as well. Now, why she had basically the equivalent of a 6th or 7th grade education, and she was adapting to English better. She was still an emergent English speaker. She was not fluent yet. So they were doing pretty well, so much so that their SNAP benefits were reduced because they, as a family of 5, they were above the minimum level that's listed for families living below the poverty level. And they were doing pretty well. They were both working, and they were really happy to be here, and the kids were thriving. And then she showed up here one day, like 2 years after we resettled them. And it was back when we did walk-ins. And so the receptionist buzzed me, and I came out and talked to her, and they were long out of the refugee resettlement program, so that I couldn't get a caseworker from that program. And so obviously they would have been referred to Isaac, but I didn't have anybody here. So I got an interpreter on the phone, Roding, who was our star Burmese interpreter. And basically what she came in for is that she had a bill for an ambulance, and she knew it was a bill because of the form and it had a business reply envelope in it. So she knew it was some kind of bill, but it wasn't like her Duquesne light bill, which she knew how to pay that. And so it wasn't one of their monthly expenses. And she had no idea why she was getting this bill. She was really panicked. It was over $200. She had to call an ambulance. Her husband had a hot appendix, and it had been bothering him for some time. And because both of these people, their biggest fear was losing their jobs. because their dream of America, aside from their children not living under the persecution that they did, their number one dream was to have a house, because in Burma, they were prohibited from owning property. So that was their dream. So they were squirreling away as much as they could. So their biggest fear for both of them was losing employment. So he worked in a restaurant, an Asian restaurant in Shady Side. He did not have paid sick leave. She worked in Oakland at one of the hotels, cleaning 20 rooms a day, and then going home to pick up her kids and do everything that she had to do. Like I said, they were doing fairly well. Her salary had increased. She was working almost $9 an hour now. She'd been there a couple of years. She was a good employee. So they were better off than some of our clients, definitely. And they weren't, like I said, happy. He did not seek medical attention because although they had health insurance, they had a high deductible. And he was so terrified of losing work. If he called off work, he would get fired. And then that income wouldn't be coming in, and he was working 6 days a week. So it got to the point where the appendix ruptured. And he had, when they arrived at the hospital, his fever was over 103. He had so much pain, she could not get him on the bus. So she called an ambulance. And that's how they got back into working with JFCS, because she didn't know what this ambulance bill was. So in the course of the conversation, she talked about how afraid she was and how sick her husband was and everything. And we made the decision to, if they were interested, to enroll them in service coordination. So any family faced with a medical tragedy, because he did lose his job, he was in the hospital for 9 days, if I remember correctly, because there was sepsis involved and there was this infection that was spreading throughout the body, and he was very ill. So he was in, normally you have a hot appendix, they go in and they take it out and you're home in 48 hours. So he had a lot of side effects, and then he wasn't able to go to work for a while. So he did lose his job. So they were living on her salary. And so very quickly they fell behind. They were 2.5 months behind on their rent. Now this happened after we started working with them. So in a normal family that did not have the resources available to them that they did, they could have ended up homeless. Like, you have one medical disaster, you have one type of catastrophe, like maybe you do own your home and you have to replace the water heater or the furnace because the gas company put a red ticket on it, and it's winter and you have to replace that, and you're talking about thousands of dollars. So many families are living paycheck to paycheck are just a few steps away from a disaster. This family had a happy ending because they had a couple things going for them. First of all, like I said, she had received several raises, so she was making more money than he was. They had a local landlord. They were not renting from an apartment building complex that maybe their office was in Cleveland. They were renting from a guy who lived across the street. They were in an apartment in Mount Oliver. The landlord, this was his only property. His wife's parents died, and they decided to convert the house into 2 apartments. They were on the bottom. There was a tenant on the first. So they knew their landlord. They saw them on a regular basis. They had excellent communication with their landlord. So they had a good relationship. They also were excellent tenants. So the landlord wanted to keep them. And in fact, when I called him to talk about a payment plan to see if that was a possibility, before we got into the conversation, he told me how great tenants they were. Like, he said, they've planted vegetables all around in the flower beds around the house. And she scrubs the sidewalk, and they always report maintenance issues right away, and their rent is always on time. So they had a good relationship. Not all tenants have that. Communication between a landlord and tenant is paramount. The other thing is that she didn't wait. She came in as soon as she got the ambulance bill. So we were able to help her with a plan before it got totally out of control and it went to the district magistrate for eviction. The other thing in her favor is she had JFCS. Like, we resettled this family. She knew the type of services she received. She knew many of the staff by name, especially our medical case manager, who she adored. So she reached out to us. So we enrolled her in service coordination. The first thing the service coordinator did was help them redefine their budget. Like, what are their expenses? What could be cut? We talked to the landlord. We applied for financial aid for the family to pay. We were able to get financial assistance for the 2 months back rent because they did have a self-sufficiency program. Because by the time the rent got to that point, he had already found another job. So moving forward, they would be able to pay their rent, but we still had 2 months that they were behind on because she was trying to pay as much as she could. So the landlord was willing to set a payment plan up for the half a month's rent. We were, through a program here at JFCS, were able to get them emergency funding to pay the 2 back rents. But also, before we got to that point, they had a 6-month-old. And one of the things that made her cry when she left the office is we gave her 4 packs of diapers. So them not having to buy diapers when they were struggling with the most basic things. We got emergency food from our food pantry. We gave them toiletries and cleaning products. Like behind me, you'll see I have boxes of new shoes for children. To my right, I have boxes of new coats that we give to families. So, and maybe many of you on this call have contributed either when the food pantry is collecting food for something or we're looking for toiletries and things like that. I mean, we're really fortunate to have supporters like that. So we were able to reduce their monthly expenses by just providing toiletries and cleaning needs and diapers. They saved a lot on the diapers because she would have gone back to cloth diapers, but she was working huge hours and, had 3 children. That was a big thing. The other thing that worked in their favor was the Burmese community in Pittsburgh is very close knit. So almost immediately, her neighbors and friends were bringing food to the house. They were volunteering to watch her kids while she worked every day and then went to the hospital to sit with her husband until visitation hours ended. So all of these things worked in their favor. There are many families that don't have those factors working for them, and that made the huge difference. And this family is doing much better than they were at that time, that they're thriving and they're doing well. And in a couple years, they'll be eligible for naturalization, and they're still working toward their goal of buying a home.
Thanks for sharing that, Brenda. That's amazing. And it's amazing that that family could come through that on the other side, especially knowing that so many people can't. They can't weather that, what starts as a $200 ambulance bill, or for those who aren't in the know, weathering a check bouncing fee of nearly $40.
Or an eviction on your record.
Mhm.
That kills our clients. Like once you have an eviction, you've lost a major pool of landlords, and you're talking about higher rates if they're even willing to rent to you because of that. That's on your record, it's really difficult.
Right. Absolutely. Well, I wanted to do a check here. Thank you, Brenda and Javier, both, for sharing some financial definitions and terms that are really helpful in setting the tone for what does it mean to be financially insecure, and what are the institutions that are out there that are working to combat this. And Brenda, you really tying it into how that ties into our work at JFCS. But I wanted to turn it over and leave some time now for Q&A from our small group of participants. We're grateful you are with us tonight. I wanted to open it up and see if any of you have specific questions for our panelists, for Javier or Brenda. Also happy to chime in myself, and I have some questions, but I want to leave it open for all of you first. And so, Jeffrey, I saw you turned your camera on, and I thought that might mean you have a question for us.
No, I thank you for the presentation. I appreciate it very, very much. And it's very interesting. And Javier, you might be interested. My brother actually is the chief legal officer for Greenlight Financial. And Greenlight is the financial literacy debit card for kids, and they're focused on so you should connect with them. I'm sure they're doing lots of programs all over the country with underprivileged and people, and they're trying to really work on that to make a difference in society, and it's very much aligned with what you're doing.
I'd love to, Jeffrey. That'd be great.
I think we'll be able to facilitate getting some contact information from Jeffrey for you, Javier. And so I'll make a note of that. And Matthew, I see you have your hand raised as well, so I'll open it up to you.
Yeah, thanks, Becky and Javier and Brenda. Thank you. And you've given some great examples of people who did reach out for help, and we were able to provide support. The Jewish Community Economic Vulnerability Study in 2021 demonstrated that the guilt and shame were really huge barriers to people seeking out resources and seeking out help, and even just basic financial advice, such as, how do I open a bank account? How do we break down the stigma about talking about financial insecurity, much in the way that I think we've made some inroads in talking about mental health, but still really talking about financial vulnerability is such a taboo topic for so many. Any thoughts on how we sort of foster that conversation?
Good. Yeah, thanks for that question, Matthew. Here's my personal opinion and thought on it. I think one of the most beneficial things that we can do is focusing on who delivers the message to certain demographics. I'll backstep and say this. Talking about financial literacy, financial vulnerability, I have been a part of it in the past where that message comes from somebody who does not relate to vulnerable communities, low and moderate income households, people of color, people of underrepresented demographics. Whether or not that's to put it bluntly, whether or not that's a old white banker who they'll deliver financial education, but they'll talk about it in the context of saving $5,000 a month, and you're talking to people who might not even make $5,000 a month. So I think we should be intentional about who delivers the message, how they deliver the message. It's certainly, like, when you're talking about financial vulnerability, about being financially insecure, if you're delivering that message, you have to be empathetic. You don't necessarily have to come from that environment, but you have to be empathetic and you have to understand it. You have to understand what these people are going through, which I think, unfortunately, a lot of people who do deliver the message don't do.
If I can give a sort of example to that, is that we register families for WIC, which is Women, Infant, and Children. And it's a great program, provides additional nutritional support for pregnant and parenting mothers, postpartum mothers. The program is very difficult to navigate because it's federal guidelines. So families are given a list of what foods are covered that they can access in the grocery store. But because of the feds, they're very specific. Like, an 8-ounce jar of peanut butter might be included, but maybe the larger one is not. And the supermarket, on the shelves in the supermarket, the little WIC logos that are on products is really tiny. And if you're not a native English speaker, you may not know it. So oftentimes clients get to the register and they're told that that's not covered by WIC. And sometimes we've heard about cashiers being really rude, but in the most case, it's just they're saying that's not covered. You want to pick something else. They're trying to be helpful. And there's this big line of people waiting to check out, and they're kind of rolling their eyes and stuff. Families often stop using WIC because they feel ashamed and they're so puzzled. And I was on a little diatribe about WIC one day in a meeting. I meet once a month with our food pantry director. And I was saying about, how unuser friendly it is for people that are emergent English speakers. And he said, Brenda, our clients at the pantry that English is their native language, often when we talk to them about food, they're not using WIC. They're sticking to their SNAP because they don't understand it either. And they have English, or they're underusing it. Like, once they know, okay, this brand of eggs is covered, or this size jar of whatever is covered, or this fruit is covered, then they overbuy that, or maybe they let some of the money, they don't spend it, because it's so difficult when you get to the register and you're not sure. And I don't share that example as a criticism for WIC. The staff there is great. We work in partnership with them, and they agree with this. It's the federal guidelines, and it's very, so even a program that is designed to provide nutrition to people that are food insecure is often difficult to navigate for these people.
I would agree with that. I'll add one plug is to your point, Matthew, about how do you kind of overcome that stigma associated with money or banking or anything like that. I think a few things that come to mind for me that I've seen in our community, and really highlighted by the work that Brenda and Javier are doing at Neighborhood Allies and here at JFCS, talking about money, normalizing talking about money. I think we do that at JFCS. We do it through our staff. We talk openly in we have sessions where folks come in and talk to our team and our staff about money, budgeting, investing in the future, credit, understanding those pieces. And I'll put a plug here for my previous employer, which is the Financial Empowerment Center, which also is in partnership with Neighborhood Allies and how I first got to know Javier. And it's grateful for that time, but creating a service that is judgment-free and stigma-free in our community here that can help people overcome that stigma, and where they can go into a space and say, I have trouble with this, I have this debt, this is where I spend my money, and not feel judged by it, but say, okay, let's talk about now where this fits into your budget. And to be able to have a resource that anyone in our community can take advantage of is hugely helpful and beneficial. And the Financial Empowerment Center is just that. And the one other thing I'll touch on, because it relates to work we do at JFCS and that Javier and the Neighborhood Allies team are doing, are starting to talk about money at a young age. I think there's a real need, and we're seeing a real need in our community to bring financial conversations into starting at elementary school levels. If any of you follow the Consumer Financial Protection Bureau, maybe that's just my nerdiness that does, but I love the CFPB. They have these amazing books that organizations like JFCS, Neighborhood Allies can get for free about how to talk about budgeting and money and savings with cartoons and pictures that are really geared toward any level of financial understanding. But they're a fantastic free resource that is available to anybody who wants them and can help to ease that conversation. And the earlier you start, the less stigmatized it becomes. And it creates a foundation, hopefully, where folks aren't falling into that financially insecure net that has entangled so many in our community and in our nation. And so those are some pieces that have come to my mind through my previous work and even tonight's discussion. Do we have any other questions from anyone in the room? And Margaret, thank you for your comment. I know Margaret had to jump off, I think. But I guess I have maybe just one question that we can use to kind of wrap this up. But Brenda and Javier, you know, when you think about the work that you're both doing, which thank you for sharing, the work of JFCS and Neighborhood Allies to combat this is immense and respected. But what are you seeing nationally? What else is being done that people can be aware of, or that organizations or individuals might be able to tie into to continue the fight against poverty, against financial insecurity? Are there any tips, tricks, resources that you would recommend for others doing really great work that might be beneficial for our group to know about tonight?
Yeah, I'm just going back to my transit example. Both Detroit and Chicago in the last couple of years have implemented a program that if people are paying daily for the bus, once if they're loading a card and they're paying as they go, like every payday they add money or whatever, once they have paid what a monthly bus pass would be, then it automatically converts to a monthly bus pass. So they're not paying double. Philadelphia, I used to live in Philadelphia, and that was brought up a number of times, and it failed every time. But and there may be other large urban areas, but I do know that Detroit and Chicago have done that, which I think is a great idea.
That's awesome. Thank you for sharing that. Javier, I want to give you a chance to respond, but I also see we have a hand raised from our
I had a question. So you're talking about people that see it as stigma, but I think there's also a population that doesn't see the safety net as being aimed at them or for them. And I'm thinking, and they sort of fall into a weird category because in a way they're falling into the issues. But I think college students definitely are not only are they food insecure, but they are absolutely, drowning in debt. And yet I think that that population doesn't see themselves as looking, or tell me if I'm wrong, looking towards your type of organizations for the help. They say, that's not for me. And I'm curious, how do you, it's not just stigma, it's informing people that it's there, and also changing their viewpoint so that they see it as being for them.
Yeah, Amy, that's a great question. I'll take this one, at least to start. Working with that age group, Becky very briefly mentioned the financial empowerment centers. The financial empowerment centers are, it's such a great service. It's free one-on-one professional financial counseling for anybody. I mean, there's no requirements to it. You can go as many times as you want, meet with a certified financial counselor, work on building your credit, reducing your debt, building your savings, working towards purchasing a home. Pretty much any financial topic you can think of. I do think, bluntly, a lot of those services, they're a commitment, they're voluntary, and they're a commitment. I don't know too many 18-year-olds, and this is reflected in the demographics of the FEC clients. I don't know too many 18-year-olds that are like, yeah, I really want to go. I'm going to go, to financial counseling every month, and meet with my financial counseling and stick. So there's that challenge. Which I mean, we talked about some of the, let's call it solutions to that. We touched on it briefly, right? It's introducing those topics earlier in life, doing it in a, which is challenging, but doing it in a non-dry way, in a fun way. Yes, I understand it's difficult to make money fun for a teenager, but I think we can do better at it than we do. And just I'll close by saying this, because I think it's another demographic thing where teenagers, 18, 19, 20-year-olds, they want, and especially in this generation, they want what's easy, they want what's simple, they want what's quick. And that's why we're seeing that's why we're seeing the market trend of 60% of people in the country use Cash App now, or Cash App or Venmo or PayPal. We're because they're simple, they're quick. You can download the app on your phone and have a Cash App in 5 minutes. Whereas, to get a bank account, you just have to do more, right? You have to either go into an account or into a bank, or even if you're opening on one online, you got to upload your photo ID. It's just, there's more to it, right? So it's, I hope that regulatory practices, and we're seeing this a little bit, like I hope that regulatory practices can make it a little easier to get the safer, more affordable bank accounts, but also make it more difficult for people to get those services that are too often predatory, right? It is too easy to get a Cash App or a Venmo or a Chime that, I think I think in the next 2 to 3 years, we're gonna start to see some market regulations towards those things. But anyway, I rambled there. So thank you for the question. That was a good one.
You're right though, Javier. And I will say, even from my time at the Financial Empowerment Center, the biggest demographic was individuals in their mid to late 20s and early 30s. Mm-hmm. And you know what the number one topic they were coming to the FEC was for? Student loans. So mm-hmm. Amy hit it right on the head there. Now, and these are individuals who had jobs, and we see this in our career services team too. Individuals who have jobs, who are earning an income, but can't make ends meet because of maybe debt or dreams that they have that they want to hold, owning a home, to Brenda's point about her client, owning a home, owning a car, but things that are not, they're prohibited from doing those things, maybe because of student loan debt or other financial mismanagement, credit cards. Javier spoke about predatory lending and how easy it is for those. It's also really easy to get a credit card at a store. So, Amy, your hand is back.
I had one more question, because I always have questions. So Brenda was talking about that you have people that aren't using the WIC money because it's it's just too complicated, or it doesn't work for them, or they're so. Is there an approach by some of the policy organizations to try and get the WIC to change to be something that's more user friendly? I mean, it seems to me that for a lot of these issues, there's help, but accessing the help is really difficult. It's so confusing that even people with a lot of education still don't get the things done right. So I'm curious whether or not some of the organizations that try to make I'm thinking Second Harvest, is it Feeding America, or some of those organizations that look at how do we try to get the government to change, whether they've been, whether there are any attempts at doing that and whether they've been at all successful.
I mean, there are a number of organizations that do lobbying in partnership with other organizations, and certainly Food Access is one of those. In the greater scheme of things, though, as Matthew and I've talked about, is that, this is all USDA controlled about what can be covered and not. So I think what would be more helpful, do I think that some of those things should be changed? Yes. But I think there are other things that we could do in between, like talking to grocery stores about better labeling WIC products. One of the things that we've started to do, which is a big drain on staff time, but if we want to make sure the clients are using it, is that when we enroll a family in WIC, we take them to the grocery store, we meet them at the grocery store the first time, and we go through and we take their cell phone and we have them take pictures of everything that's covered under WIC, so that the next time they're there, they don't have to worry, did the sticker fall off the label? Or what if I can't read English? They can just look and they can hold the product up against their phones. So that's one of the things that we've been doing, because I think while I think that we should continue to lobby Washington about things like this, and by we, I mean all people that work in this and citizens, and we can all call our legislators about it. But I think more grassroots stuff, I think that there are more ways that could directly help them rather than trying to change federal regulation.
Absolutely agree with that. Thank you, Brenda. Do we have any final questions? I know we're over time, but I wanted to just make sure we're getting all the questions from you, our attendees from this evening. And okay, well, if not, I think Brenda and Javier, thank you so much for sharing your expertise, your knowledge, your work with those of us who are here tonight. And to our group, I know some of you have dropped off, but thank you so much for attending. I hope it was useful and that you learned something. And I think, Christy, will we share contact information after the fact, or if anybody has questions, make sure that they have a way to be able to follow up with us, like Javier getting you that connection. I wrote down Jeffrey's information so we can get you that connection that he spoke about.
Yeah, of course. I will send I will resend all your contact information to our attendees. And even for those people who had registered and were unable to attend, we can give them the recording as well. There was a gentleman who just had a hard time coming in and he just couldn't do it. I was on the phone with him, so I will definitely send him the recording as well. Yeah.
That's great. Thank you. And Matthew, you're our last attendee holding out. Thank you for joining us tonight.
Thanks.
Greatly appreciate it.
Yeah, this was fabulous. Thank you all.
Thank you, Matthew.
Thank you for joining us.
Thanks, Matt.
Bye.
Bye.